Are you afraid of taking statins? If so, you're not alone. About 2/3 of my patients really don't want to take statins. They've heard about bad side effects. And a lot of that story is true. There are bad side effects with statins. However, there's a bigger reason why most of the medical community still recommends them. And we'll talk about that today. On a personal basis, I delayed my own statin use for about 5 years. I ended up regretting it. I had significant buildup of plaque in my artery walls. Once I did get started, though, I was able to decrease the plaque burden in my artery walls. See other videos that I've done to talk about how to measure that plaque, because that's the key to looking at risk for heart attack and stroke. Now let's go back to risk and benefit for statins. About 3 or 4 years ago, in 2013, 2014, there was a debate in a couple of English medical journals, the British Medical Journal and Lancet, about the side effects, the rate of side effects and the seriousness of side effects from taking statins. As a result of the publicity around that debate, thousands of people stopped taking their statins. As a result of that decrease in statin use, thousands of people started dying from heart attack and stroke. Now, if you don't believe that, let's look at the numbers and make your own choices. So there was a recent publication of what's called a meta-analysis. It took all of the known studies of statin use. It set it up in terms of numbers to where you said, okay, there are 10,000 patients. We're watching them for 5 years. How many side effects would you have among that 10,000 patients, and what would be the benefits? First, let's look at the side effects. Out of the 10,000 people, 5 years of use, 5 myopathy cases. Myopathy is breakdown of muscle tissue, and it can get serious. Myopathy has known to kill people. New onset diabetes. Many of the statins, but not all, have been shown to increase somebody's progression along what we call the diabetes highway. These are people like myself who have some insulin resistance and are headed towards diabetes. Some of the statins push the patient a little bit more quickly. Among those 10,000 people for 5 years, there were 50 to 100 will go on to develop diabetes earlier. Again, a significant number and a significant result. Hemorrhagic stroke. Now this is debatable. There is some potential, some possibility that statins can create hemorrhagic stroke. Many of us don't believe that it's actually true. However, there is some evidence. If so, it looks like up to 5 or 10 people out of those 10,000 for 5 years. So we've got some significant issues here, and it's clear why there's so much fear and concern about statins. Out of 10,000 people, 5 years, 5 serious myopathy cases, 50 to 100 cases of new onset diabetes, and 5 to 10 cases of hemorrhagic stroke. So why would anybody take statins? And why would you see a medical community like this? I had a patient a few weeks ago say, "Doc, I've seen 4 doctors, 2 cardiologists and an ER doc, and now you. Every one of you has said, you look great. Maybe you should be taking a statin." That patient did have some risk and did have indication for statin. But let's go back and look at the benefit side of the equation. Out of that same 10,000 people, if those 10,000 are relatively low risk, the statins will prevent 500 deaths from heart attack and stroke. If it's a high-risk population, the statins will prevent 1,000 deaths from heart attack and stroke. So again, we're balancing benefits and risks. On the risk side, you've got at most, 115 serious side effects among those 10,000 people. On on the other side, the benefit side, you've got at least 500 deaths prevented. So, like Pogo said, you take your money, or you pay your money, you take your licks. Which one am I going to take? I think it's pretty clear to me. I'm going to take my statin.